Right. That sounds really bad. Would I have to have like surgery to remove it? That scarring.
Well, these spots of endometriosis can be so small that the only way to see them can be with a laparoscopy, which is a camera procedure. Now, that's a surgical procedure, and the main aim of doing that would be to diagnose whether you do have endometriosis or not, but also treat the endometriosis by removing it, which we call excision surgery.
So you wouldn't know that you had endometriosis unless you had that?
Not necessarily.
So it seems like quite a lot to go through surgery just to find out if you've got it or not.
Absolutely, and it's a very personal choice. There are alternative options for treatments, so we'll talk about those in detail, and then you can decide what you want to do next.
Okay.
It's really important when we think about options for treatment of endometriosis that we know that there's no real scientific evidence that one treatment is better than any other. So it's really all based on your symptoms and maybe a bit of trial and error to see which side effects affect you and which don't, and which treatments are of benefit to you.
Okay.
So the first option is what we call conservative management. And what that means is using pain relief to manage your symptoms better.
Yeah, I've tried pain relief. It didn't do anything, but...
Okay. So you said you've tried paracetamol. Have you tried anything else in terms of pain relief?
I did try stronger ones like cocodamol, but I was getting constipated, and so my IBS, it just was a whole issue in itself, and I said natural things that haven't really helped.
Have you ever tried anything like an anti-inflammatory, like ibuprofen?
No, I've not actually.
Okay.
I've not.
So because we think endometriosis is an inflammatory condition, anti-inflammatories are really helpful. So a trial of ibuprofen would definitely be worth a go.
Okay.
The other thing that sometimes people find helpful with pain from endometriosis are things like nerve blocker pain relief, such as pregabalin or gabapentin. They are drugs that have slightly more side effects than ibuprofen, so it would be worth trying the ibuprofen first, but just knowing that that's another option in the future if you need to do it.
Okay.
The second option would be what we call medical treatment, and that's using hormones to basically turn off your ovaries, stop that monthly cycle, and hopefully then improve the symptoms of endometriosis by doing that.
Like the pill?
Yes, exactly. So the options for that are, the most basic option for you would be to use the pill that you're on, but instead of having a break every 3 weeks, using it in three monthly cycles. So having 3 packets back to back, followed by a week's break.
Can you do that?
And yes, you can. And then you'd only have a period every 2 to 3 months rather than every month. Some people find that quite beneficial. Other options would be things like the progesterone-only pill, or we have other alternative progesterone therapies, and they're tablets that you take almost continuously, and again, to do the same thing. Or something called the Mirena coil, which is a small plastic device that goes inside the uterus and stays there for 5 years. Have you ever heard about that?
I have, yeah. I've had a friend who's had it and she said it was quite uncomfortable, but I think she ended up bleeding a lot of the time.
Okay. Well, as I say, it's really individual, and a lot of these treatments are trial and error and see what suits you. Another option just to mention is something called GnRH analogues, and basically they're injections that can induce a temporary state of menopause. In terms of side effects, it can be quite extreme. People can get more side effects with that than they do with the other hormonal options. But again, it's worth knowing that that option is there for you should you need it in the future.
It sounds a bit extreme, but yeah.
Most of the time people start with the basics and then work up to things like that later.
I didn't know about taking the pill like back to back, and that's something I would probably like to try actually. Yeah.
So the third option would be surgery. You mentioned earlier you're a bit worried about the thought of that.
Yeah, that obviously I think that hormones, extreme surgery seems, just quite a lot to go through, especially not quite sure about what there is, or from what you said, it does sound like I've got endometriosis. It sounds like I finally found the thing that, to say what's been going on, to give an explanation about what the pain's been. But yeah, I think surgery, what would the surgery involve?
So it's a keyhole procedure. So it's called the diagnostic laparoscopy. I appreciate I've given you an awful lot of information.
Yeah, it's a lot of information to take in,
but I'll definitely give you some patient information leaflets about it, and about endometriosis, and also about the Mirena coil. But the laparoscopy is where we have a look inside the tummy with a camera and aim to remove all the endometriosis that's there. As we discussed earlier, that's the only real way of knowing for certain that this is endometriosis. But many women choose not to have that diagnostic procedure and try different treatments. And if they suit you, then you don't necessarily need a formal diagnosis.
Okay, well, I definitely feel happy to start with some of the options like a bit lower down and then see where it gets to.
Okay, so what I'll do then is I'll arrange a follow-up appointment with you, but we do have a specialist nurse, endometriosis nurse, who I'll give you the contact details of, and you can contact her anytime you like, if you want to have any more information at all, or if you have any further questions.
Oh, that's really good.
Is there anything else you'd like to discuss today?
No, I don't think so. I think you've answered everything there, and it'd be good to get some leaflets to go through it and speak to my boyfriend as well.
Yeah, brilliant.
Yeah, it's
okay.